Good morning, everyone, and thank you so much for being here today and for your interest in my research project. My name is Sophie, and today I will be presenting my research topic with my PI, which is Dr. Tamara Lowton in the Department of Pathology. Our research project for this summer will primarily focus on the validation of pathology data elements in national prostate cancer tumor registries. A little bit about the background of prostate cancer. Adenocarcinoma of prostate is the most common form of cancer in men, and it is the fourth cause of common cancer death in men. Surprisingly, you will be able to find prostate cancer is more likely to develop in African American men compared to other races. Men who are diagnosed with prostate cancer will first undergo the biopsy in order to determine the cancer grade and further recommend it to be treated with either active surveillance of the tumor or radiation, or they can even undergo radical prostatectomy. Here on these pictures right here, we will be able to see the Gleason grade. Here, these are the microscopic slides that you will be able to find all of the glands of either regular prostate gland or it's going to be the cancerous tumor tissue. The prognosis is highly associated with the tumor grade, which is observed microscopically by biopsy or radical prostatectomy. For your prostate cancer, with the Gleason grade, you will be able to have 5 different grade groups. Here, as you can see, for the grade group 1, your Gleason score and pattern, you will have a total of 6. Grade 6, which is 3 plus 3, or either you will be graded group 2 for grade 7 for 3 plus 4, or grade group 3 will be grade 7 as well, but here you will notice there's a slightly different patterns in here. 3 plus 4 will give you a grade group 2, and 4 plus 3 will give you a grade group 3. And the reason why it's so different is because if you look at 3 plus 4, this means that your primary pattern in the prostate cancer tissue will have a pattern 3, which is either of these patterns right here. And then your secondary pattern will be pattern 4, which you can see all of the tissues on the microscopic slide will look pretty similar like this. Grade 7, the total is still grade 7 here, but it will be graded grade group 3, and that's because here on your primary pattern, you will find pattern 4 is your primary one, and your secondary pattern will be 3. This will make the Gleason grade goes higher because 4 right here will be more aggressive compared to the pattern 3. Here on the grade group 4, you will have a total grade of 8. It will be either 4 plus 4, 3 plus 5, or 5 plus 3. And grade group 5, it will have a total of either 9 or 10. And you will have it as either 4 plus 5, or 5 plus 4, or 5 plus 5. And if you can look at this picture, primarily in prostate cancer tissues, you will be able to find pattern from 3, 4, and 5. Rarely in cases you will be able to find pattern 1 and 2. So we look into the SEER program. So what is the SEER program? SEER program stands for Surveillance, Epidemiology, and End Results. Here, you can also see that the SEER program, it is also funded by the National Cancer Institute, and they collect all of the data on every cancer cases, including diagnosis, treatments, prognosis of approximately 30% of the U.S. population. The SEER program also plays a very important role in a population-based resource to study about cancer by geographic regions, groups of ethnicities, time of diagnosis, and capture all of these additional data for tumor marker. They expand biospecimen banking to improve the future of advanced cancer research study. And SEER is also used by thousands of researchers to better understand the factors associated with the cancer outcome. Here, as you can see for our research value, this is the figures where you're able to see that SEER data used by scientists, researchers, and health professionals, it has been increasing significantly all over the years. And here at 2018, the amount of research paper study that was collected from SEERs has spiked significantly. So most healthcare professionals will use SEER cancer registry data to study cancer, and they will evaluate the prognosis, diagnosis, and the treatment of cancer. So acknowledging the accuracy of cancer registry data from SEER program, it helps improve the outcome of the cancer research studies. So we do want to look into this accuracy of the SEER cancer registry data. Methodology. We primarily use response study. Response study is actually a national network of prostate cancer researchers who collaborate together on the study of prostate cancer in African American men. And the response study that will help defining the roles of genetics, tumor marker, and social stress. It aimed to recruit 10,000 African American men with prostate cancer. The response study will also use these data to examine the accuracy of SEER data elements by collecting pathology report and tissues on all cases to cross-validate the grade of cancer that we were talking about before. For our objective for the research project for this summer, we correlate the outside pathology report grade with the registry grade that we collected for 49 sample of prostate cancer biopsies and 163 tissue sample of radical prostatectomies. We aim to look at the differences and variations in these sample and further re-examine to compare a tumor grade with experts at Johns Hopkins. And we also want to compare this pathology grade versus the cancer registry and continue to evaluate these reports versus our own tumor grade. However, there are a little bit of research limitations that we have encountered. First of all, both of the sample tissue from biopsy and radical prostatectomy are not large enough for us to compare. So far, we have just only received 200 cases to study these slides and reevaluate the report grade. Second, our sample from radical prostatectomy are very small, and we just only received one block of sample tissue to examine. Normally, for your radical prostatectomies, you will have all different blocks as a result of the sectioning of the radical prostatectomies, but we just only received one block, so that would limit us from actually looking into other tissues in order to compare. The prostate cancer grading system has changed over the years, and it is very unclear on what grading system was applied to older samples. Small size sample from cancer registry has limited our research as well, meaning that we are unable to break down the differences by location of different tumor registry. And cancer registry seems to include the grade of biopsy of prostate cancer, but not the prostatectomy. So this also entails some difficulty for us to examine the report grade as well. We have came to the conclusion on the results from the radical prostatectomy. Here, this is a comparison between registry grade group 1 cases versus the pathology report grades. As you can see it here, 60% of the cancer registry grade and the pathology report grades will match with each other. However, there are 36% will be upgraded into grade group 4 and they're into grade group 2, and 4% will be upgraded to grade group 4. And also the same with here, as you can see for grade group 2 from the cancer registry and the outside pathology report, you can see that 60% will be matched for grade group 2, and there are 12% will be downgraded to grade group 1. Meanwhile, there are 22% of the data will be upgraded to grade group 3. There are 2% will be upgraded to grade group 4, and there are 4% will be upgraded to grade group 5. So we can see that all of these data are not properly matched with each other. On the next slides, you will be able to see the comparison between the cancer registry grade group 3, grade group 4, and grade group 5. And compared to the pathology report grades, there are significant differences as well. Here, on the grade group 3, there are 55% will be downgraded into grade group 2, and there are just only 39% will actually match between the data from cancer registry and the outside pathology report grades for the grade group 3. Meanwhile, you can find that we found that there are 3% will be upgraded to grade group 5, and there are 3% will be upgraded to grade group 4. For registry grade group 4 cases, we found out that it is so surprising how we are able to see the upgrade and downgrade in these groups. We found that there are 24% will be downgraded to grade group 3, and there will be 29% will actually matched between the cancer registry grade and the pathology report grades in grade group 4. And there are 23% will be upgraded to grade group 5, and 24% will be downgraded to grade group 2. And same with the case for cancer registry data grade group 5 cases versus the pathology report grades. All of these data are not perfectly 100% matched with each other. We can find that there are 31% data will be downgraded to grade group 4. Meanwhile, you can find 8% will be downgraded to grade group 3. There are also 15% will be downgraded to grade group 2. And here you can find the 46% will be able to match with the grade group 5 of the cancer registry. And at the end of our research study, we were able to conclude that there are still a lot more data for us to study more on these data from the cancer registry program, which is called SEER, versus all of the outside pathology report and even our pathology report here at Johns Hopkins. And all of these discrepancies in the data, as we can see so far, is because of many reasons. It can be a typo from the cancer registry. It can also be because the cancer registry does not keep up with the data or the patient's medical record, starting from when the patients have the biopsies until they are being actively observed and until they encounter with radical prostatectomy. And that was it for our research topic for this summer, and we'll continue on working further to look into more of these data in the future. Thank you for your attention.